Hi, thanks for the opportunity to give this short talk. My name is Dr. Daniel Grace. I am a GP based in South Wales, near to Brecon. And I'm just going to give you a quick overview on some of the things that I do as a GP that are maybe slightly different to what you might think. I believe general practice can open many doors. Um, Partly because the clue in the name of being general and actually staying as a generalist rather than sort of becoming super specialized can actually allow you to do quite a lot of different things you might not have otherwise thought of. So when I came to the end of my training, I sort of looked around at all my peers who were going into salaried jobs and partnerships and thought, well, I'm not sure if I want to come straight out of training and then do that. I wanted a bit of freedom. I thought about locuming, and that's what I started off with. But I was really interested in trying to try lots of different things, really, and get that variety in my working week, and make sure that that sort of allowed me to have that freedom and sort of reduce burnout and things like that. And these are some of the things that I now do. So um, locum work and out of hours work is still quite important to pay the bills. Some of these other things are either voluntary or for sort of minimal payment, but they do allow me to then come back to locum and out of hours work feeling refreshed and still kind of enjoying medicine, which I think is quite important, particularly in the state of the NHS at the moment. So I work in travel medicine. I'll tell you a bit about that. Event and expedition medicine, which sort of go hand in hand, and one is probably a progression of the other. And that sort of allowed me to then sidestep into medical education, teaching on courses, but also working with several medical schools and also postgraduate education for GP trainees. I then sort of thought that I quite enjoyed sort of supporting and nurturing people and seeing how they're getting on. And I suppose the next logical step was to kind of think about becoming an appraiser, which is what I now do. And then later this year, I'm going to start working with the GMC, doing some examining for them. And then there's two voluntary roles that I do, which I really enjoy. The first is basics. So that is essentially immediate care with MedServe Wales, who are a voluntary organisation that sort of provide enhanced care to the ambulance service. And then I'm also the volunteer medical director for the Virtual Doctors, who are the UK's leading telemedical charity. And I'll tell you a bit about what we do there. So a fair few different things, but actually having that generalist background is pretty important for all of these. Um, so just to prove that I do some traditional general practice, yeah, locum work is still important. Um, Nomad is the travel company I work for. They have various clinics which are mainly nurse-led, but they also have a few doctors on board. And what we do essentially is we vet medicals that have been done usually overseas for people who are deploying with the say the Children, British Red Cross organizations like this. And we're essentially risk assessing, risk stratifying, and working out whether people are safe to be deployed overseas for their assignments. And that's actually really interesting, a good insight into, well, a different industry, things that you maybe wouldn't know so much about, but also different healthcare systems and potential barriers. And you also have to have a bit of tropical disease knowledge as well. So I did the diploma in tropical medicine for that as well, up at Liverpool a few years back. So this is my medical director role. Um, I've written about it in various different places, but very briefly, yeah, we connect rural health centres with NHS doctors using a smartphone app. And essentially, the idea is that we prevent unnecessary referrals where patients might have to walk for a day or two to a hospital. The doctor might then not be there, and this comes at great personal and financial cost. And if we can provide that same information remotely, then the idea is that we can actually educate clinical officers, reduce unnecessary referrals, improve patient care, and empower rural health. And it's a really interesting job, actually. My main role is to answer cases, coordinate different volunteers, but also look at the overall kind of governance, recruitment and also look at our strategies moving forward to see where we want to go as a charity. So that's really rewarding. Slightly different from that is event medicine. So these photos are mainly from within the UK, I think. So you can be dealing with things like blisters, having to look at ECGs, managing acutely unwell collapsed patients who are often very cold and dehydrated. That photo is from Land's End to John O'Groats trip. That's Glenshee in the Scottish Highlands. And you get to meet some really interesting and inspiring people who like to put their bodies through stressful events. And then that sort of naturally progressed into expedition medicine. So I've done various courses in this. And this is the Kenyan tea plantations, essentially. So you can see in that top picture, that's the Rift Valley behind us. And this was the Impact Marathon in Kenya. Actually, this turned into a relatively cold place with torrential hailstones and it's very wet, some flash flooding, and actually the participants were at great risk of developing hypothermia, so getting cold, which was something that we hadn't really thought of for Kenya. So that was quite surprising. And I did tag a quick bit of safaring onto the end of that. Now moving over to Canada, this is the Canadian Yukon, so pretty high up into the northwest of North America. And this is working with youth development. Really great to be able to empower young people to sort of discover themselves and have opportunities that they might not otherwise. And this is with British Exploring Society. They take people from vulnerable backgrounds, the fostering agency, and things like that. And that was really good fun as well. And again, being a generalist is quite important here because you're dealing with or potentially anything that can happen. But just because you're going into the middle of the wilderness doesn't mean that all the typical things that people develop day to day don't happen. It just means a few other things might happen as well. And then moving to a slightly different environment again, so to the desert in Jordan with people doing charity challenges. This was in aid of various cancer charities with a bunch of predominantly women going to Petra in Jordan, which was really good fun. The desert is a beautiful place to trek through. And there's me with Shakira, the donkey, emergency ambulance, which had to take on a few dehydrated people every so often, but thankfully nothing more serious than that. And then at the start of this year, I was lucky enough to go to Fiji and work there for 3 months and get myself on some TV credits, which was pretty cool. My GP surgery was either a hammock between some palm trees or it was this picture in the middle. So that is our makeshift GP surgery, which also had sort of various medications. So we had a mock-up resus department as well, in case anything more serious came through. Had to think about public health. So those Petri dishes are actually full of water samples to see why everyone had diarrhea. I had to think back to ophthalmology. So there is someone with an eye condition, which we had to put some staining in for. So that's a pterygium, and that's actually due to UV light exposure. So all sorts of different things, but also being able to manage with acutely unwell people, trauma, and that's a picture of our fracture and our stretcher even, and scoop in the boat down there. So that was a really great experience. But actually, having that journalist background was really important for that as well. And then I suppose the natural side step from there was to teach on various wilderness medicine courses, which I've been doing for the last few years, which is good fun. It's always entertaining. Certainly doing these simulated search and rescue sessions and also being a casualty can be good fun at times. And sometimes getting pulled out of my car as well, just to sort of think about more pre-hospital scenarios. I've written about some of the things that I've been up to on doctors.net, if you're a member of that website, and also GP Online, where you can have another look at some of the things I've been doing. And then my other interest is medical education. So specifically at simulation, something that's traditionally been in secondary care. I'm more interested in looking at in primary care and thinking how can we give people the skills to manage emergencies in primary care. looking at both pediatric emergencies, adult emergencies, and then looking at the human factors and how we sort of develop that in situ, which is really interesting. In fact, we've just been running the first human factors in primary care session just now today, which I hope is going to be a pilot and a good template to sort of move forwards to develop an area that's really important, but kind of completely unaddressed in primary care. And then lastly, the other job I do, which is voluntary, is to go out in this enhanced care response vehicle to support the Welsh Ambulance Service. So this is usually with anaesthetists and paramedics. And as a GP, I feel a bit out of place at times. But the idea is that I'll then be able to develop certain skills to help me in some of my other roles, and work towards becoming a responder, probably a team responder, and getting the diploma in immediate medical care to help me on the way to that. So lots of exciting things you can do with general practice. And I hope this has sort of shed a light on that and given you some ideas that you might not have otherwise thought about. If you do want to get in touch with me, as I say, my name's Dr. Daniel Grace. I have a website called thewildernessmedic.com. You can find me on Instagram or Facebook as well. And yeah, I hope that's been interesting and informative. Thanks for the opportunity to kind of give this information, and I wish you the best of luck with the rest of your training.